Hi, and welcome to West Des Moines, Iowa, home of Plaza Dental Group and Dr. Steffany Mohan. This is Tanya Bailey with the Total Patient Service Institute, and this is Amy Beamer. She is a financial coordinator, treatment coordinator, and really an everything coordinator with Plaza Dental Group. And Amy is going to give us a tour of the practice.
Yes.
Take it away, Amy.
Come on in. So we are located on the first floor of our office. We're in an R&R Realty building. We walk into the building, we'll go through the glass doors and we're in the suite on the left-hand side. Alright, so this is our waiting room. Here we offer hot coffee and water that is complimentary. We try not to keep the patients waiting, so as you can see it is pretty empty in here. Okay, and this is our financial team, other financial coordinators. This is Tony and Sally. So we would be the ones to greet you when you walk in the office. We'll go right on back here to the clinical team. We do have a very long office. So this is Ashley, one of our assistants. We actually have 6 dental assistants in the practice. And back on this side is the hygiene area where we have 6 hygienists. This is Susie working with her patients. We'll walk down the hallway here. We actually do have a consult room. And this is Melanie, another one of our financial coordinators. Keep on walking down the hall. We have 4 doctors in the practice. Some of the services that we offer are regular treatments such as crowns and fillings. We also do implants, 6-month smiles, Invisalign, and other cosmetic treatment if the patient needs. Here's one of the assistants. This is Elizabeth. She's with one of her patients. And then this is Dr. Mohan working on one of her patients.
Hi.
We'll continue down the hallway. We actually have 14 suites, and that includes the 6 hygiene suites. This is the suite that we do most of the implants in. It is a bigger suite, and this is where Dr. Mohan actually teaches her courses for the implant courses. So there's more rooms for doctors. Here in the office, we also do True Denta, and this is actually our True Denta room where we do most of the treatment.
All right, so Amy, tell me, what are some of the things that sets your practice apart?
Well, we're more than a team, we're a family. So we treat each other great, and we aspire to treat our patients just the same, just as our family.
Excellent. Well, thank you for the tour, Amy. It was great to see you.
Thank you. Hi.
All right. So good morning. This is Dr. Steffany Mohan of Plaza Dental Group in West Des Moines, Iowa. Dr. Mohan has been practicing here for over 18 years now. So Dr. Mohan, what has been your most effective marketing here in West Des Moines, Iowa?
Well, I always think that the best marketing is being kind to people and being caring, and obviously doing the best dentistry we can possibly provide for people. But ultimately, we use a combination of a lot of different marketing, and I think that's what's been really successful is we don't try to have one thing do everything. I'm not really looking for volume at all in my practice. We're looking for good, high quality patients just like everybody else. We would really like to have people come in and want the best dentistry that we can provide. And we place a lot of implants here. We do a lot of 6-month smiles. We do a lot of comprehensive dentistry. Obviously, we're always looking to do comprehensive dentistry for people because it's just better care. But ultimately, we can market to some of those specific things that we do. When we first started in this location about 8 years ago, we actually started with anxious patients and people that just didn't like to come to the dentist. And it's so much fun to convert those people and have them turn into raving fans of dentistry, not just ours. I mean, I'd rather have people really enjoy dentistry and then they can go anywhere if they move or anything like that. So marketing, web marketing obviously has increased dramatically in the past several years. We use our website very effectively. We're always working on our website. We do a lot of articles and a blog and that kind of thing. We do social media, just really entering the conversation that's already going on out there. It's interesting to see people that will will comment about their dentist online, and that's really interesting to me. Of course, it's never great when people have negative experiences, but hopefully that doesn't happen very often. But marketing is just really reaching out to people that are lacking something and they really want something. And strangely enough, the best way I've heard of marketing is that we're selling hope. And there are a lot of patients out there that really would like to have hope that they can find a dental office that they're comfortable with, or just really something that they can try again because they've had either bad experiences in the past or they just haven't had somebody that will talk to them and listen to them.
All right, so I'm here with Amy and Sally, who are the backbone of Plaza Dental Group. Amy and Sally are on the administrative team, and they really just do some of everything in the practice, whether it's greeting patients, financial coordinating, jumping in the back, showing off their beautiful smiles, or assisting. They just do some of everything. So ladies, can you share with me what are some of the best team activities you've done that's brought everyone together and made this a better place?
Well, yesterday was really big for us. We actually had our tops girl, Tanya, come in, and we had a meeting, and we made personal goals and kind of broke down some walls that we had all been kind of butting heads against, and there were some tears, but it was really eye-opening, and it really felt like it was a very bonding experience yesterday.
Awesome.
I'd have to agree with Amy, just with the whole TOPS experience. Half of our office was able to go last year, and then the other half just recently went, and having everyone except 2 people having the TOPS experience, it has really brought everybody really close together, and knowing everybody's on the same page. And TOPS is just such a great information, just because there's so much information that can take you so far in your personal and work life, and it's really great, and it's nice to work with a family. It's awesome.
Great. So what are some of the things I've heard you guys mention? You do some weekly activities as a team. Tell me about some of those.
Every other week we work Fridays from 7 a.m. until noon. So when we close the practice, we try to get everyone to go out to lunch together, where we can kind of build as a family as well, just being able to spend time together outside of the practice.
Awesome. So this is just part of the amazing dental hygiene team at Plaza Dental Group. We've got 4 this morning, and one of the things the hygienists are going to share with us is what are 2 or 3 of their secrets to success in their practice. So we have Tamara on the left, we have Joelle, Heather, and Susie. So ladies, what are those secrets to your practice success?
I would have to say that we have a very, very large team, lots of women, but our personalities all really mesh together. We work as a team, we bond as a team, we play as a team, we work hard as a team, and we have a total team concept here at Plaza Dental Group.
Excellent. Anything else anybody wants to add?
I would say comprehensive-wise, we don't miss a thing. They get the whole package when they come here.
Great.
I think all of our personalities go really well with each other. And so what one person's thinking, the other one's thinking, and so it's just like a well-oiled machine. We're just always in sync with each other. So.
Excellent.
And that
I'm
has
always learning.
that has a lot to do with all of our systems that we have in place. That really makes us run efficiently, and we don't miss a beat, like Susie said. We have it down.
Great. Thanks for your time, Hygiene.
Thank you,
Thank
Tanya.
you. Bye.
So I know that you guys are very community oriented. So can you share with us some of the things that you do to give back to the community?
Yeah. A couple other things that we do. Last year around Halloween, we do a candy buyback for military service members. So we actually open our office, and local children can bring in their Halloween candy, and we give them $1 for every pound that they bring us. And last year, I think we actually had around 600 or 700 pounds of candy. And it was just, I actually started crying because there was a kid that was so happy about getting this money for his candy, and it was a really great experience to see, and it just really opens your eyes that people are so giving, and it's really nice to work for a practice that opens up their office to do things like that.
Got it. What else? I know you guys have been top office for Smiles for Life in the past, so tell me a little bit more about what else you guys do.
We also do IMOM, which is Iowa Mission of Mercy. So we kind of offer some donated dental services through that, where it happens once a year in Iowa, and they select a designated area where a lot of dentists kind of participate with that to give people who don't have insurance or can't afford it a chance to get their dental work done. Dr. Mohan and one of our hygienists actually went to
The Dominican Republic.
The Dominican Republic,
Yep.
and they also did some donated services there, and that was last fall.
Awesome. So if you were going to give maybe a secret of the practice success, what would you say would be some of the pearls from your office that you could share with other practices in the Crown Council?
Tops.
I'm paying them for this.
I would say just really opening up and being honest with the people that you work with. I think it's really beneficial because we have 20 people in our office and we get along so well. People think we're absolutely crazy for getting along as well as we do, but it's just really nice because if we do have an issue with something or somebody or a situation, we can go directly to that person and get it resolved. And it's just really nice to be able to do that and just move on and move forward to bettering the practice and everybody that goes along with it.
And it also helps having a boss who tells you that she loves you.
Yes.
Oh, awesome. Well, thanks so much for sharing, ladies.
Thank you.
So tell us, Dr. Mohan, about some of the biggest challenges you faced over the last 18 years.
When you said that you were going to ask me that, I thought, what hasn't been a challenge? I would say, getting and training and keeping a great team is a challenge. Finding the time to put into it, to running the practice is a challenge. Working on the practice instead of in the practice all the time is a challenge. Learning what you need to learn, continuing education. Those of us that are kind of junkies and we like to go learn things all the time, it's great. I love having people like Tops come in and teach us because it's on our home turf and we don't have to go. It's all been such a blessing. I'd love to say, everything has been a challenge, but in a way it turns into a blessing. So I can't really say that it's been a bad thing. And we even talked about this, Tanya, that if I didn't look at it as, if I didn't grow from it or I didn't learn from it, then that's one thing. But hopefully I've learned a few things along the way. There's certain things that I used to do that I would never do again. So at least I've learned a few lessons all the way. There's this, dentistry is a challenge. It's hard sometimes, and it's fantastic sometimes, and it's a great thing, but it has its moments that are worth all the struggle. But everything's been a challenge, and I'm just and I try not to see it as all a challenge because I know there's always a silver lining. But there definitely, everything has been a challenge for sure.
So what would you say some of your biggest accomplishments have been?
Well, I lived through all the challenges, so that's good. I think my biggest accomplishments are, I have found some freedom with my practice situation. I practice a couple days a week because it's been really important to me to be, the mother that my kids deserve and the wife that my husband deserves, and just make sure that I have the freedom to be there. When I was early in practice and I was working all day, every day, and I came home and kind of gave my family the leftovers, that was, I actually like to eat leftovers, but I don't think it's the right thing to give my family. So, I think that my biggest accomplishments have been that I've tried really hard not to neglect the people in my life while I've been growing a practice and working hard on the business side. So the personal side, of course, is what's going to still be there, hopefully, after the business is, after I'm too old to do the business. So I'm really, I'm so fortunate that my family hopefully still likes me. And
Awesome. So if you were starting all over again tomorrow, what would be some things you would do the same, and what would be some things you would do differently?
Well, I would take the serious things seriously, and I would take everything else a little less seriously, I think. I've learned to prioritize, but it's been a really, really long road on trying to figure out what's important and what's not. and it's the don't sweat the small stuff, and it's all small stuff type of thing. So I think I would do a lot of things differently. Of course I would take the people as seriously as I take the people, and we've been talking about mentors, so Dr. Roy Hammond that does all of the mission trips for Smiles for Life is just so fantastic, and he says it's all about the people, and it's always all about the people, and it is. And anytime we forget that it's all about the people, then we get in trouble. And so hopefully in a practice situation we remember that every day, and it's about the team, it's about the people, the patients, and it's about making sure that we're still a person, and we make sure that we're well taken care of as well. It took me a lot of mentors and a lot of people to make me realize that I was worth putting on the map, and that was a really hard thing to do. Evidently mothers have martyr syndrome or something like that, so it's a hard thing to do, because you sort of feel like, well, if I put myself last, then everything will work out, and I think that's actually opposite. If you have to put yourself at least somewhere in the top few positions, or it's going to be a pretty difficult road. So
awesome. So one last quick thing, because you have so many pearls to offer. So if you were going to be speaking to a new dentist or a new practice owner, what would be your one big pearl you would want to share with them? I know, trick question. I didn't prep you for that one.
No. I'm so glad you asked. Let's see. What would I tell them? I would tell them, take dentistry seriously, but don't take yourself too seriously. Have fun with it. Remember every day to certainly to have gratitude, but have joy. There was a really kind of a pretty reasonable stretch in my life when I realized, as I looked back over it, that I had sort of lost the ability to feel joy, and which was very scary. But when I recaptured that, I realized that that was something that I really wanted to be very mindful of. So make sure that as frustrating as dentistry and life and everything can be, make sure that you take time to enjoy and count the joy, and don't lose the joy, because that's sort of what life is about. And when we lose the joy, that we turn to things that we shouldn't be doing, and behaviors that we know are not helpful. They're destructive behaviors. So make sure that gratitude and joy enter into every day of your life.
Awesome. Thank you.